Hi, everyone. Welcome to all of our families and caregivers joining us for the 6th annual Stork Storytime EXPO, sponsored by Mercy, Iowa City. I also want to welcome our panelists. Thank you for taking time to share your knowledge with all of us. Our expo has a different format than prior years, but we're thrilled to still be able to offer this virtual opportunity for our families and caregivers to connect with the experts. I'm Jennifer Jordebreck, and I'll be hosting the first of our 2 panel discussions with Kelly Forkenbrock, who'll be moderating. So I'll go ahead and ask questions of the panelists, and Kelly will be watching the chat area for us. Our families will be on mute, but if you have any questions, go ahead and type them into the chat section, and we'll get them answered at the end. This is the health panel discussion, and at 2 p.m. we will have our educational and support services discussion with different experts joining us. Both sessions will be recorded so you can refer back to them as needed. Before we get to our questions, let's take a few minutes to introduce our panelists. Panelists, please introduce yourself. Tell us how long you've been at your job and what you do there. Let's start with our sponsor, Mercy, Iowa City, represented by Mary Beth Geske from Lactation Services.
Hi there. My name is Mary Beth. I've been a nurse for 10 years. I have joined Mercy, Iowa City in the last year. I've been here a year as a lactation consultant. Additionally, I have a partner named Deb Ruff who's worked here for 20 plus years, so she has that great expertise as well. At Mercy here, we offer daily lactation coverage, including the weekends. So no matter what, you will be seen at Mercy and get a one-on-one consult if you're a breastfeeding mother, breastfeeding parents, really. Thank you.
Thanks, Mary Beth. Thanks for joining us today. From the University of Iowa Stead Family Children's Hospital Safe Sleep Team, I'd like to introduce Penny Smith.
Hi there. I am Penny Smith. I am a NICU nurse by trade. I've been at the university since 1986, so about 34 years as a NICU nurse, and I'm currently the co-chair of the university's Safe Sleep Task Force. So that's a group that's been in existence since about 2013. Another role I have that might be relevant in our discussion today, I also work as the consultant, the nurse consultant for Iowa's statewide perinatal care program. The university chart birthing hospitals, and I review all of the deaths of infants up to 1 year of age. So I see those charts in Iowa birthing hospitals. I have a very good grasp of what the risk factors are for SIDS and sudden unexpected infant death, and I'll be happy to answer any of your questions today. Thank you.
Thanks for joining us, Penny. Next, I would like to introduce from the University of Iowa College of Pediatric Dentistry, Dr. Polly Iben.
I'm Polly Iben. I am a pediatric dentist. I was in private practice for 21 years and recently sold my practice and took a full-time position at the university in the pediatric dentistry department. And I'm happy to be taking my love of pediatric dentistry in a little different direction for the second part of my career. And so I work with residents and I work with undergraduates as well there. So I'm happy to be part of this panel.
Thanks for being here today, Dr. Polly.
Thank you.
And finally, I would like to introduce from the University of Iowa Wendell Johnson Speech and Hearing Clinic, Kate Bergen.
Hello, everyone. My name is Kate. I am a third-year graduate audiology student from the University of Iowa, Wendell Johnson Speech and Hearing Clinic. I don't have nearly as much experience as some of our other panelists today, but I'm training to become an audiologist. And at our clinic, we provide services for anyone who has hearing loss or speech concerns, speech and language concerns. Specifically in the audiology clinic, we do diagnostic as well as hearing aid work, newborn hearing kind of follow-ups for any concerns with newborn hearing. Yeah, I'm very excited to be here. Thank you for having me.
That's great. Thanks so much, Kate. So let's go ahead now and move right into our discussion. We had some questions we thought about ahead of time, and then we'll go ahead, and Kelly's watching our chat section. So families, if there's anything you want to ask specifically of our panelists, feel free to type that in there. Even though we're in a pandemic, people are still growing their families and have health-related questions, whether they're expecting, have newborns or young children, or whether they care for them. So that leads us to our first question. How has access to your physical building changed during this time of COVID? And we'll go ahead and just start with Kate, who's on my screen first, and kind of go round robin. So Kate, can you share how access has changed to your building during this time?
Yes. So our clinic was closed temporarily, but we are now open and seeing patients again, which we're very excited about, but we're taking a lot of precautions to make sure that we're creating a safe space for all patients that come in. We'll talk about this a little bit more with the next question in terms of what to expect when you come in, but just know that we've been taking a lot of precautions to make sure everyone's wearing masks and face shields, all of our clinicians, as well as sanitizing between patients.
I'm sorry, I lost the audio, but I think it's my turn. Is that correct?
Yeah, go ahead, Dr. Polyaben. How
Yeah.
has your access changed?
We were not ever shut down completely at the College of Dentistry. We were always seeing emergency patients, but now we're back on a more regular schedule. Everyone that comes to the University College of Dentistry will be thermal scanned. They'll take a thermal scan and look specifically at the forehead. And if you're running a fever, they will use an actual regular thermometer, a handheld thermometer. And if you're still running a fever, we will ask that the patients reappoint. But that doesn't happen very often. So they are being very careful to not let anyone with a fever come into the building. We ask that patients come through the main entrance of the college, the dental school, whereas staff and faculty go through a different entrance as well. So access to care too, or access to the building is also restricted to, we're hoping to keep it to one patient, one parent. Our waiting rooms are not very big, and so we're trying to maintain social distancing by not having extra people in the waiting areas. So we do ask that if you're bringing your child to a dental appointment, that you don't bring other kids in the family that don't have an appointment that day. We also, we realize that there are exceptions to this rule. If there's a large family and all of the kids have an appointment, they might need both parents to come to kind of keep watching the kids who are still in the waiting area. But for the most part, if possible, we would like just one parent, one child. And we do ask that parents stay in the waiting room unless it's a special circumstance, and that would be if the child is under 3, if there's a special health care need that we need to consider, or if there's a language barrier. And in some cases, kids are extremely anxious and do need a parent back, but we take that on a case-by-case basis. We're just trying to really limit the exposure since dentists are so exposed and at a higher risk because we're so close to the mouth and so close to aerosol and splatter. We would just want to take a lot of precautions that we're not having extra bodies in the room that we have to worry about as well. So that's some of the things that we're doing at the college to keep everyone safe, patients, parents, and staff.
Thank you. Mary Beth, how has access changed at Mercy Iowa City?
So in our facility, we've been screening any individual that comes in to the building. They will be asked wellness questions like, have you had a fever, cough? Are you feeling okay? We'll get a temperature from them. And then we are asking that you do wear a mask. Okay, that is an requirement within the hospital. And everybody's been pretty great about that, doing their part. So if you come, you can probably anticipate some questions and to get your temperature taken.
And Penny, what about at the Iowa Stead Family Children's Hospital?
So we do have some limited access to the building at the University of Iowa hospitals and clinics, and that includes the Stead Family Children's Hospital as well. If you're coming to have your baby, you'll come in probably through the Children's Hospital entrance, or maybe from the Skyway from parking ramp 2 and 3. And at both of those main entrances, all of our patients, visitors, and staff are screened. Same questions as Mercy. Have you had a fever, cough, or sore throat? You'll be asked those 3 wellness questions. We do have a thermal scanner in place for everyone. And then if the thermal scanner, I think, reads high, they'll go ahead and take a temperature. Visitation has been limited, and maybe I'll just go ahead and answer your question too with my time here, but masks are required. If you're coming to have your baby, just call first, or to visit anyone at the hospital, call before you come. Visitation has been a moving target from the beginning of COVID. It's changed several times in the last few months as to how many visitors can be in at the same time, how many visitors you can have per day. It all changes all the time. I know at this point, for moms, if you're coming to have your baby, dads can be there the whole time. And then dad is included in that 1 visitor per day. So in other words, you can have 1 visitor per day when you're on that mother-baby unit, and dad or your partner is most often that 1 person. So grandma, grandpa, I'm sorry, for that newborn admission, you're going to have to stay home in the first couple days as we get through this COVID pandemic. But it's the right thing. Please wear your mask. Don't forget your mask if you come to the hospital.
Thanks, Penny. And following up on that, some of you were able to address this already, but is there anything else that parents or caregivers need to know about coming to your locations for services during this pandemic? Kate, do you want to share anything additional?
Just kind of what my other panelists have been saying. We're following a lot of similar guidelines. Masks are required. We're having social distancing in our waiting room and limiting the number of guests that can come with you. And just kind of our appointments look a little bit different in terms of where we're speaking to you, where we're counseling following testing. Some of our booths are kind of small, so it's hard to maintain that 6 feet during testing. So we might relocate to a different spot following to do some of our follow-up after testing.
Dr. Polly, is there anything else that parents or caregivers need to know?
Right. You are required to wear a mask. If you do not have your own mask, they will give you a mask when you come into the building. Staff is also required to wear not just a mask, but a face shield as well when we are working with patients. But we do, like I said, we do require that everyone, kids 3 and over, have masks. I've even seen a 2-year-old wear a mask, and she did beautifully. But the kids 3 and up, we would prefer we want to have masks on. And like I said, if you don't have one or can't afford one, we will supply you with a mask upon entry.
Jordan, we didn't hear that question.
Oh, I'm sorry there. Hopefully you can hear me now. Mary Beth, sorry about that. Mary Beth, is there anything additionally that parents or caregivers need to know before coming to Mercy, Iowa City?
Right. Pretty similar to what the other facilities are doing. 1 visitor. So if a mother comes in labor, her 1 visitor, it's usually the significant other that comes with. No children under 18, actually no children. So usually just the significant other is no children under 18 are allowed on the unit right now.
And Penny at the university?
Very similar. I work just in NICU where the guidelines are even tighter, so I guess I can't speak to the hospital as a whole, but very similar for mother-baby unit. Yeah.
Okay, that's some good information to know. So we've talked about if people are coming to your buildings. Do any of you offer any alternatives to in-person services? And if so, can you share just a little bit about that? We'll start with Kate.
Over the summer, while we were not seeing as many in-person patients, we did have telehealth sessions. So you were able to set up a Zoom meeting with the clinician to kind of talk through any issues that might have arisen when we were not able to see you. Right now, we're trying to be as much in person as possible, but that is kind of an option that we've explored in the past.
And Dr. Polly, is there anything patients can do besides coming to the pediatric dental location?
Certainly. We have been using teledentistry from the very beginning of this pandemic. It can be a very valuable tool. I want to stress, though, it does not take the place of an official in-person dental checkup, but it can provide a lot of good information. We often do teledentistry visits with people who have something specific that they want to ask our dentist. Their child wakes up with a toothache and they have a large swelling, so they'll send a picture or a video of that area, and that can be very, very helpful, where we can look at it and say, yes, this child does need to be seen. Let's get an appointment scheduled. For a regular routine checkup, I would not advise it, because that involves not just a clinical look, but also often radiographs and things that can be missed. That can be missed clinically. Often kids' teeth look perfect, and then you take x-rays and you might see some interproximal cavities between the teeth. So we don't want to say that the teledentistry is taking the place of a well child checkup, but it can definitely help us in identifying certain problems or conditions that parents might have questions about. One example is a child with maybe a double row of teeth. They have their baby teeth on the bottom still there. Permanent teeth are coming in, so we call it a shark mouth, and parents get kind of freaked out by that. But by seeing a picture of that, or via teledentistry, we can assure the parents that that's not an emergency situation. It's a fairly common phenomenon, and we can talk them through that. And it is also important to use teledentistry for other more emergent things like a trauma, and whether we can see the information, see the child's tooth or teeth that are involved, and let the parents know, yeah, this is a true emergency. You do need to come in right away, or this is pretty minor. We think it can wait until your next checkup, or wait for the next couple of days for you to come in. You don't have to come in on an emergency basis. So it really does have its pros and cons. We just have to remember that it doesn't substitute an in-person visit. We can't see everything. Also, I want to stress with parents, if you are going to use teledentistry, make sure for the dental part, make sure that you remember that the mouth is like a dark cave. You need a flashlight, and we need good lighting in order for us to see what's happening. And it can be very difficult if you have a traumatized child with a fall, trying to get them to open their mouth and hold still. It can be very difficult to get a good quality photo. And sometimes we just can't. So at that point, if we just can't make a good call on the teledentistry, we might ask you to come in to look at that trauma. But if you can get a really good quality, well-lit photo of the area, that can really help the person on the other end determine whether you should come in or not come in.
And Mary Beth, at Mercy, is there alternatives to the in-person services?
We don't have telehealth set up, but we do, it's free to call. We are accessible 24 hours a day, 7 days a week. Our nursery is always open. We take messages in the lactation office. And if it is necessary for a parent to come in with their child, we do have a private lactation room to reduce the risk of interacting with other individuals. So, at least we can reduce the risk and offer a private environment if they do need a consult. But phone calls usually is the least personal intervention right now for what we're doing.
Okay. And Penny Smith, is there anything with the University of Iowa Family Children's Hospital that you'd like to share for alternatives?
I believe that they're doing the postpartum visit. So your 6-week postpartum check now can be a telehealth visit. And as far as I know, all of the prenatal checks are still in person. I think it's just the postpartum check. Jennifer, I'm sorry. I think I called you Jordan a few minutes ago.
No worries. I'm clicking my mute on and off, and we're all good. We're all good. So I did notice on one of the chat questions, someone did ask if mothers have to wear a mask during labor.
That's a good question.
So Mary Beth, are you able to address that question?
Yes, we've been requesting that mamas wear masks if they can tolerate it during labor. And I also wanted to add, with one of your questions, what should parents expect when they come in? We are testing mothers for COVID when they come into the unit. I just wanted to add that in case it didn't get mentioned. But, we understand labor is a lot of work. They don't call it labor for anything. We encourage it, but we don't chastise a mother if she cannot tolerate it.
That's a wonderful question. Thank you, Mary Beth, for answering that. And families, if there's any other questions, please feel free to submit those through the chat room as we keep talking. We'll go ahead to the next question then. Kate, can you share, are there any widely held parenting concerns or struggles that your organization addresses that you see from your parents, from your families?
Something that we're really excited about is that we've started doing follow-up non-sedated ABRs or auditory brainstem response testing for newborn hearing screenings or any children who fail or might not pass a screening that they get immediately following birth. We're now providing services for a further diagnostic test that can kind of help add clarity and give you direction when you're not really sure what a fail means on a test like that. We're now offering a further diagnostic test to kind of help counsel families and parents and kids in that situation. So that's something that we're really excited to kind of be providing and helping out in a really stressful time. It's hard to know when you just get a brand new baby and they're so beautiful, and to hear that they've failed a newborn hearing screening, there's a lot of different reasons why that might have happened, and it might not be because of permanent hearing loss. So we're really happy to provide that testing to kind of help confirm or either hearing loss or no hearing loss later on following that sort of testing at that time.
Thanks, Kate. And I did notice in our chat room we had a follow-up question. So Penny, are you able to address at the University of Iowa hospitals whether mothers in labor need to wear masks?
I believe that they do. And I think the reason for that is that exhalation is, particularly in the pushing phase of labor, it's aerosolizing. In other words, you can spread droplets during that as you breathe out during labor. So I believe that they are asking moms, the same as that Mary Beth said, if they can't tolerate it or they refuse, then that's okay. But yeah, they are asked to wear a mask during labor, and we are testing as well. All women who come in labor are tested for COVID.
Okay, thanks. Dr. Polly, are there any parenting concerns or struggles that your organization sees commonly?
Access to care is always an issue. With pediatric dentistry, we see patients from several hours away that come to the college for care. Also now, amid COVID, there are a lot of private dental offices that are no longer taking Medicaid. And so that becomes an issue for many of our parents. They might have been able pre-COVID days to go to their local dentist because that person accepted Medicaid, but now many of them are not choosing to be Medicaid providers anymore. So they have to travel a lot further. So I think that's probably one of the main problems that our parents are facing, many of our parents are facing, is access to care that's close by. I also did want to mention too that our children that we take to the operating room at Stead Family Children's Hospital, if they have special healthcare needs or excessive, severe dental caries that can't be treated safely in the dental office, we will take them to the operating room to get the procedures done under general anesthesia. Those kids are required to have a COVID test prior to getting their surgical procedure done. And I believe it's the day before that they have to have it within a day, so that we know that we're taking kids under that are COVID negative. And that's another safety measure both for the kids and for the dental team and the anesthesia team that's working on them.
Okay, Mary Beth at Mercy Iowa City, do you guys see any common parenting concerns or struggles?
Well, recently in light of the COVID, there's a lot of parents that are concerned that if they get COVID, do they continue breastfeeding? And the answer is yes, continue breastfeeding as long as the mom can tolerate it. COVID is not found in breast milk. It's the best way to protect your baby. So we just think some parents are very concerned about getting, hey, what happens if I get sick or if one of our family members gets sick? Do I separate from my baby? Do I give them a bottle of formula? And we really like to encourage to not separate a mother and child. So we've been addressing that, really trying to encourage parents, even if they get sick, to continue breastfeeding. Also, I guess on this unit, they do, parents ask us a lot about exclusive breastfeeding. Does it have to be all or nothing? Can my baby have formula as well? At Mercy, we can offer a exclusive breastfeeding experience. We have the donor breast milk through the Mother's Milk Bank of the University of Iowa. So that's a service that we offer here too. In relation to the lactation department, those are two of the things that have come up lately.
Okay, thanks. And Penny, with the Safe Sleep team, is there any parenting concerns or struggles that you commonly see being asked?
Well, I think if I can steer it towards safe sleep specifically, I think one of the common things that parents struggle with a little bit is what they see in the hospital versus the message of safe sleep that we send them home with. And I think particularly if you have a sick or a preterm baby, what you're going to see in the hospital are therapeutic positioning devices. You'll see babies sleeping not on their back. If they're preterm, they're sleeping on their side and on their tummy frequently. And then as they get older, we transition them to safe sleep as they get healthy, and once they get to the point where they can, where their condition, where their respiratory support is down, and they're getting bigger and older, then we transition to safe sleep. But I think it's hard for parents sometimes to marry those two things, to see those things in the hospital, and then we go home with the message, nothing in the crib, on his back, to sleep only. And I just want to reinforce that message. Our goal now is to, certainly within 2 days, 2 or 3 days prior to discharge, that's exactly what you should see in your baby's crib. There should be nothing in baby's crib. He should be sleeping on his back. We make a huge attempt to model safe sleep and send baby home with the same recommendations, the same things that we'd like to see you do at home.
Okay, thank you. And we did have a question from one of our families. I think this will be directed at Kate at the Speech and Hearing Clinic. If my child's hearing aids stop working or breaks, but he has an up-to-date hearing evaluation, and then the question went away. So sorry, I didn't get the rest of that question, but maybe can you read?
I'm sorry.
I found it.
Yeah, it's in the answer. I put it in answered before you finished. But the question is, if my child's hearing aid stops working or breaks, but he has an up-to-date hearing evaluation, do we need to have an in-person appointment?
So that's not necessary. If you have an up-to-date evaluation with those thresholds, we can program the hearing aids. If you drop them off at our clinic, we can program them without you having to be there to reduce the risk of spread of COVID. We have ways to kind of program those, still using best fitting practices to make sure that your child's getting as much amplification as they need, but they don't have to be there in person.
Okay, thank you. These are some great questions. Thanks, families. Keep those coming. We do have a follow-up question from a family, and I think it was about during labor wearing the mask. They want to know if a shield is acceptable instead of a mask.
That is a good question. The shield is not it's not a replacement for staff, so that kind of goes for the mamas too.
I think I would agree with that, Mary Beth. The shield, we've had some advice about the face shields, and if you're not wearing a mask under your face shield, you're really not as protected. We really need the mask, and I believe that it's the same advice here. It's a mask and not a face shield. Again, I'm not a labor and delivery nurse, so those questions should be directed to your primary care provider. That's a great question. Be prepared before you come, for sure.
Thank you. Wonderful questions, families. Go ahead and keep sending those into us, and we'll keep answering them. So the next question we have for all of our panelists is, everyone's heard of the term mom guilt. For our purposes, we could easily phrase it as family guilt or caregiver guilt. Do you hear that from any of the families that you serve? And if so, do you have any advice for them? What's kind of the concerns that from the families? And that might kind of also be similar to the prior question we asked, but just thought we'd toss that out there. Kate, do you see any of that?
We do see that sometimes when we deal with pediatric hearing loss. Oftentimes there's some sort of genetic component, and there's nothing that the parents should feel bad about in that regard. It's not something that you can control or change. So I think the best advice that I have is to just kind of come to terms with that as best you can. We're there to help you process and understand what your child's hearing loss means and what it means for their speech and language development. And then when we're there to help you put any sort of intervention plan needed in place, whether that's hearing aids or oral rehab or speech and language services, we're really there to help support you during that time, because we understand it is very difficult.
Thank you. And since Kate just got finished speaking, we have one of our in the audience is Kelly Bouchot, who is an audiologist at the Wendell Johnson Speech and Hearing Clinic, and she just wanted to expand on it. She's Kate's supervisor, so she's here as well. And she just wanted to expand on that person follow-up appointment for hearing aids. They would want to see the kiddo after programming to run feedback manager, but a majority of the appointment could be completed without the child there, like Katie mentioned. And certainly feel free to call with any specific questions, and they can discuss those specific options. So I just wanted to share that in addition to Katie's reply. Thank you very much, Kelly. Dr. Polly, do you see any family guilt from your customers?
We do. We have a lot of parents that come in and are just shocked when we tell them that their children have cavities at a young age. Some people don't realize that kids, even babies, can get cavities. Cavities are caused, it's a multifactorial type of situation. It's not just caused by one certain thing. There's many different factors that lead to dental cavities. And some people just don't realize that young kids can get cavities. So that's why we really stress the age 1 first visit to the dentist. It used to be age 3, and there was nothing really scientific about that. But years ago, that age 3 was the age that dentists thought, well, maybe they're at an age now where they can actually sit in the chair and not squirm and cry and things. So age 3 kind of became the official take your baby to the dentist year, but that over the years we've found that is way too late to start the first dental visit. We can see signs of dental disease in kids that have just gotten their teeth. If we see a lot of plaque on the teeth, if the parents are not brushing the teeth or are feeding the kids a lot of juice or other types of sweet or acidic types of drinks, any type of fermentable carbohydrate, very young kids can get cavities. And it's not our job to judge any of that. It's our job to educate and inform. There are no judgments when kids come in with cavities. We just want to talk to the parents about, we can stop this. dental caries is the #1 infectious disease of childhood. It is an infectious process, and we just need to talk to our parents and let them know that we can stop this, we can reverse it, and we can help them out. So basically, when I have a mom that comes in and her child has a lot of cavities at a very young age, we say, okay, we're going to get them back on track, and we're going to see you every 6 months, and we're going to take charge of this, and we're going to do it together as a team, because it definitely is a team project. And we, like I said, it's a no judgment zone. It has to be, because some people are just not aware that kids this young can develop cavities, and it's our job to educate and inform and be supportive and non-judgmental of our parents.
And Mary Beth at Mercy Iowa City, do you guys see any sort of family guilt?
Well, I think anytime you have a child, you can probably anticipate you'll feel guilty. You'll find something to feel guilty about, right? Sometimes a woman can't exclusively breastfeed, and they have to, use a little bit of supplement, and that's okay. As long as your baby's getting fed, any breast milk is good from mama, any amount. Sometimes she wanted an epidural or didn't want an epidural, wanted a natural drug-free delivery, and she had to have an epidural. It is what it is. You tolerate what you can tolerate, and that's perfectly acceptable. Sometimes parents will be like, hey, our newborn isn't like the older sibling, trying not to compare them, feel kind of bad about that. All babies are different, and the most important thing is that they're here, they're healthy, and we want to make everybody comfortable and healthy and safe. So I feel like that kind of is inevitable, a new parent's guilt no matter what. So.
For sure. Penny, as part of the Safe Sleep team, what sort of guilt do you guys see?
Well, I think I agree with everything Mary Beth just said about just being a parent in general and the newborn experience. It's not always what we expect it's going to be. Mm-hmm. I know from the sick baby standpoint, that's the majority of my experience is NICU, and I think many times our families, moms in particular, they feel guilty that their babies are sick, and it's one of two questions: is what did I do to cause this? And what could I have done to prevent my baby from being in this situation, from being sick or born early? But in most cases, the answer to both of those questions is nothing. You didn't do anything to cause this, and there's most likely nothing you could have done to prevent this. So hopefully we're going to just support moms through that. And babies get better. In most cases, they get better and they go home. And yeah, I think that's all I have to say.
Well, these have been some great questions. We have a few more minutes, and we'll open that up to any additional questions from our families in the audience. We do have one. I think this is more for Mary Beth and perhaps Penny. Have you had much experience with women who've had breast reductions in the past, and do you find that they're often unable or able to breastfeed? Can you speak to that, please?
Oh, yeah. That's a great question. Thank you. We do. We see mamas that come in and they've had breast reductions, different types. We see mamas that come in that have had breast implants. We individually assess the mother, and we check out the equipment, and we work with what you have. So even if you've had some breast tissue removed, a lot of times those women are able to make at least small amounts of mother's milk that we can give to her newborn. So we work with what we have. Even if she's had a breast reduction and doesn't make any breast milk, well, your baby might just love sleeping across your breast, and then you can follow up with a supplemental bottle. But we have hospital grade pumps here. We try to stimulate as much as possible, latch a baby at the breast, and anything that we get, we use. So we do see quite a handful of mothers we see pretty regular that have had a reduction for any reason, back pain, whatever it is. We work with whatever you got.
If I can piggyback on that, Mary Beth, that was a great answer for these mamas who maybe have had some breast surgery or breast reduction. And I want to remind you that any breast milk is better than no breast milk.
Right.
Certainly when we talk about the risk of SIDS, a paper came out about 3 years ago that showed us that any breast milk in the first 2 months, of life, I think the study was, reduces the risk of SIDS by 50%.
I love it. That's my favorite.
Right? Yep. I know, the angels started to sing when I read that study all alone. And
Good. Yep.
But any breast milk, so that doesn't have to be exclusive breast milk, even if your baby is getting some formula, if he gets breast milk for the first 2 months, you just cut his risk of SIDS in half by 50%.
Yep.
So it's worth a try. Be talking to your lactation consultants like Mary Beth, because they can help you and give some breast milk. Breast is best for everybody. And even if it's just a little bit of breast milk, it's the right thing to do. And we really encourage you to try.
Thank you for that, Penny. Go ahead and send in any more questions you have, families. We have a few more minutes. Ahead of the panel discussion, we had a few questions come in. And for our speech and hearing clinic, can you share, are there any signs that families can look for if a child may have trouble hearing?
Yeah, so we like to say that the parents are the experts on their child. So any time you have concern is probably a reason to come in and at least get them tested. Often if they're not responding to louder sounds like you'd expect, having reactions to noise and sound in the environment, that's kind of a good indicator, but that's not always the case. Sometimes it's not very obvious. So if you have any concerns, or if you have failed any of those newborn hearing screenings, even if they don't end up having permanent hearing loss, it's good to bring them in and get them checked out whenever you have any concerns at all.
Thanks, Kate. And for the pediatric dentistry, how can caregivers or families care for their baby's teeth at the very beginning? Like, do they start out brushing their teeth, or what are some tips you can give them?
Right. As soon as you have your baby, we encourage you to, even before they have teeth, start wiping off their gums with a very soft washcloth, wet washcloth. That will do a couple of different things. It'll keep the mouth clean. It will also get the baby used to you being in her mouth or his mouth. As soon as the teeth start to erupt, we need to start brushing them. Not with toothpaste, but just with a little tap water, fluoridated tap water. If you don't have fluoride in your water, you might want to get fluoride baby water. And this will help protect the enamel on the teeth. We need to make sure that you brush along the gum lines. Where babies tend to get cavities is along the gum lines of the top teeth and on the first and second baby molars when they come in. So you really want to brush along the gum lines, and don't forget about the backs of the teeth. We often will see kids who, if they smile, their teeth look beautiful, and then you look with your mirror behind the top front teeth, and the whole back sides are cavitated. And often the parents may not catch that until the cavitation starts wrapping around the front of the teeth. And by that point, a lot of times those baby front four top teeth are not salvageable. So when you're brushing, make sure that you're brushing not just the front sides of the teeth, but also tipping the baby back a little bit and tipping the head up a little bit so you can brush the back sides of the teeth as well. Remember that the teeth have three different sides, the cheek sides, the biting surface sides, and the tongue or the palate sides. So make sure when you're brushing to brush all three surfaces. Be very, very careful with juice. Juice is a real culprit in terms of cavities. Even if it's natural juice, even if it's no sugar added juice. We say no more than about 46 ounces of juice a day, and we recommend that you only put juice, have them have juice at table time. Don't let them walk around the house or the mall with a sippy cup of juice. If you're going to use a sippy cup, have it be water only. Don't ever put them to bed with a bottle of juice. Juice is got a lot of, even the natural juices have a lot of acid, and so it's the acid and the sugar. And we are strong supporters of breastfeeding in pediatric dentistry. Breast milk in and of itself is not cavity causing, but breast milk in conjunction with a sugary diet has a synergistic effect. That's when you have this explosive cavity situation where many teeth in the mouth get cavitated. It's when you have the sugar added into breastfeeding. So breast milk in and of itself is not cavity causing, but make sure you're not adding to the child's diet with the sugary juices or the acidic drinks. Gatorades are really bad for baby teeth. That's when you can kind of get this explosive, full mouth decay situation. And also, again, stressing that first visit to the dentist should be at age 1, provided that they have teeth. Most kids do start to have teeth at 1. The kids start getting their first teeth around 6 months. So at about age 1, they need to see a good dentist for the first time and get checked out.
That's some great information. Thanks, Dr. Polly. And we
You're
did have
welcome.
another family question come in. Has there been any information released as of yet on pregnant mothers and infants receiving the COVID vaccine? And is there any subsequent side effects?
Well, there is no vaccine for COVID yet. I think we're all waiting for the vaccine, and who knows, sometime next year, I hope that we have a vaccine. As far as pregnant women and COVID, and Mary Beth, you can back me up on this, but I believe the most current information about pregnant women and COVID, so moms who get COVID while they're pregnant, is that those moms can be sicker than just another woman of the same age who was not pregnant. Now, we didn't think that in the very beginning with the first studies that started coming out about COVID. We didn't think pregnancy made that woman any more at high risk, but that has changed a little bit. So we certainly, if you're pregnant, protect yourself. Wear a mask when you're in public. Follow the social distancing guidelines. Don't go to big parties. Keep your groups small. Keep it tight. And protect yourself wherever you go. Mary Beth, anything else on that?
Yeah, I wasn't aware of any vaccine as well. And just being pregnant kind of decreases your immunity, and being pregnant and being sick at the same time would be kind of a miserable experience. But no, like you, I hadn't heard of a vaccine, and just mama can just wear a mask and hand wash and drink plenty of fluids and take care of herself, just like you were saying.
Okay, wonderful. Well, thank you so much, everyone. Unfortunately, we're coming up here on our time. We're going to go ahead and start doing some wrap up things here. We're going to go ahead and put up the screen, share the screen. I think Kelly is going to be able to do that with the contact information for all of our panelists today. After our second panel discussion, we'll go ahead and do the grand prize drawings, and we'll connect with those families. We want to let our families know that if for the next couple of weeks at the library, you can come in, make an appointment, call us for a half-hour appointment, and you can come take a look at a couple business tables. Our for-profit organizations, Usborne Books and More, and Sensory Kids Therapy Services support their EXPO fee for our READS program, and in turn they have a business table that you can come check out their products and services. So feel free to come in and do that. We are at limited capacity at the library, and you will need to mask up, but give us a call at 319-626-5701 if you'd like to come in and check out what they have. Also, from our website, we have the business bios from each one of our vendors. They have done a wonderful job on these. We're going to leave them up until the 2021 EXPO, so you can take a look at those at the northlibertylibrary.org website and take a look at each one of those. Also, the swag bag pickup, if you have not been able to collect your bag of goodies, they are stuffed full. Our vendors really were generous in what they are giving to you guys. So they literally are stuffed full with all kinds of treats and prizes and pamphlets and flyers and wonderful information. So you can still pick them up in the next week through our library hop service at the library. Give us a call again. We also invite you to laugh, listen, and learn with our monthly Stork Storytime Talks podcast, which you can also access from our website. It's on the SoundCloud platform, and you can also listen wherever you listen to your favorite podcasts. If you are expecting, we invite your whole family to participate in our Stork Storytime Reads program, which helps you develop a reading routine before baby and chaos arrive. And after baby has arrived, you can transition into the 1,000 Books Before Kindergarten program. That's for infants, toddlers, and preschoolers. 1,000 books sounds like a lot, but you have quite a few years before they hit kindergarten to work through that program. It does promote school readiness, and you earn wonderful prizes through both programs just for reading. So following a brief break, we're going to start our second session, which is the Educational and Support Services panel discussion, starting at 2 p.m. We hope everyone can join us for that. We're also going to record it. And again, both sessions will be available on our website. Thank you so much to all of our families and caregivers for joining us today. And thank you so much to our panelists for participating in this panel discussion. And we also want to thank our sponsor, Mercy Iowa City. We hope to see all of you in person for our 2021 Expo.